I'm Dr. Pedersen. Today we'll be going over problems that can happen with the rotator cuff tears and rehabbing those, and impingement syndrome. It can be very, very painful, especially with any overhead lifting or lifting out to the side, even with trivial amounts of weight, sometimes even just with the arm. So definitely something that is an important teamwork between the doctor and the patient whenever we're trying to find a resolution for these type of problems. Shoulder is the most mobile joint in the body and also therefore has the most instability. And so we want to make sure that we create stability. The way that the body does that is with the rotator cuff muscles. There's 4 of them: the subscapularis, the infraspinatus, the supraspinatus, and the teres minor. They provide a support structure for the ball and socket joint, which is your glenoid and your humerus. So this makes a ball and socket. If you can see here in the picture, this is a very, very shallow socket, and so it leaves a lot of instability here. That's where the rotator cuff muscles come in. The rotator cuff muscles, if we use too much weight, and too much weight, more than 3 to 5 pounds, in working them out and rehabbing them, the prime mover muscles, the big muscles around the shoulder joint, will take over, and we won't be rehabbing these stabilizing muscles. So you want to make sure during these exercises to use very light weight. And what we're going to do here is help when the shoulder is moving for this joint to stay together instead of sliding around. These exercises are a continuum, slowly progressing to get more and more complex movements of the shoulder. If you're progressing too rapidly in these exercises, they can cause pain. You will progress and be able to do them all, hopefully, but we need to do this in a progressive fashion. So we're going to start first with a exercise for your supraspinatus muscle. That's the muscle that is most commonly torn with a rotator cuff and spinatus exercise. What you're going to do for this exercise is lie on your side like you're lounging at the beach. You can see here that she's got her leg kind of bent, that's her back leg, and she's kind of propped up almost in a side plank. Bring your arm out, palm facing down, elbow extended, and then you're going to bring your palm up to this level here of your knee, and then slowly back down to the level here, not resting at the bottom, and you're just going to continue to do that motion. Very important that the motion going down is controlled and slow. It should take you about 3 seconds to do that motion. We do sets of 15 of these, about 3 sets. We can add in weights. You would not want to do more than 3 pounds with this exercise. So this is the maximum weight you would use. And again, you'd bring this up slowly and slowly back down. You might feel this right back up here in the shoulder joint as that getting a little bit of a workout. But mistakes that people can make: their palm is facing up like this, or their thumb is facing up. You want to have the palm facing down. Their arm is out in front of them, so they're doing this type of thing, or they go way, way, way too high, right? The activation of this muscle is just from about here down, and you just want to do that very slowly. Very good exercise and very foundational and basic to shoulder rehab. So for this next exercise, this is a scapular stabilization exercise. Helps your body to train your scapula here. How to move around your thorax, your chest wall. Very, very important for rehabbing any shoulder thing. Also for helping to pull your shoulders back and get a better posture. So what we're going to do is you're going to be on all fours with your knees underneath your hips and your hands underneath your shoulders. Your elbows are going to be locked and they're going to remain locked. Your arms should be straight the whole time. We don't want to see any of this with your arms. And then what we're going to be doing is working the muscles right here in the back. What we're going to have her do is a push-up, just utilizing these muscles. So she's going to take and increase the space between the table and her chest, and then decrease the space from the table to her chest. So try that, okay, and come down as far as you can, and then go back up as far as you can. Go as far as you can, really perfect, and then drop that back down. Good, and then do the opposite. Perfect, all the way as much as you can. Good, down. We want to maintain the back in lordosis the whole time. This is not a cat-cow type of yoga posture where we want to see this all round. We want to leave this in lordosis, or kind of arched here, and then taking and really bringing these down, and then getting as much space as you can between your chest and the table. Perfect. What we can do with this exercise is then progress to putting more weight here by the amount of lever that we put on the body. So here we're doing a knee push-up and doing that same scapular stabilization. So you can do that down as far as you can and then back up as far, never bending your elbows. Perfect. It's a push-up without bending your arms. Then if you get where you progress past doing a knee push-up, you can go to where you're doing a full push-up with your knees off the table in a plank. And again, doing a push-up going down as far as you can and then coming back up as far as you can. Lastly, what we can do is use a gym ball, like the one here, that becomes a labile surface, makes it so you have to use your stabilizer muscles even more. And so we can then do the push-up. We're going to take something, it can be a pillow or something. This is called a Dynadisc. Just set this on the edge of a bed or a couch or something where you were going to do this. You're just going to want to make sure that your shoulders are hanging off the edge of whatever it is. You can scoop. Bring the scapulas together, the arms up, and then rotating, making a field goal sign with the thumbs up, and then slowly coming back down, arms down next to the side. Perfect. And lastly, scapula is being released all the way down. Good. Scapula coming together, arms up 90 degrees to the body, thumbs coming up in a field goal position, arms being released back down, and then letting the arms come down, and then lastly the scapula being released. Perfect. And we're going to do it one more time showing you with the weights. Good. And then slowly returning and back down and then releasing the scapulas. Good. Perfect. Common mistakes that people make. First of all, people will lose their scapular stabilization here. So first, keep this. Then when these arms come up, sometimes people will have them down at an angle like this. This needs to be at 90 degrees to the body here. And then lastly, when they bring this up, they'll forget to bring their thumbs up, or they'll bring this back down here when they do that. We again want to keep everything at a 90-degree angle. Bring this back down. Good. Drop your arms down. And then lastly, release your scapulas there.